all you wanted to know.
My name is Kendra.
So Kendra, what's your interest in medicine?
I am very interested in neuroscience as a whole. My future goals are to go to PA school, physician assistant school. And so right now I'm working as a clinic assistant / scribe to try and get some of that clinic experience.
Tell people what the scribe is. Everybody may know what the scribe is.
Yeah, a scribe is the person that goes into appointments with the doctor and takes all their notes, helps a lot with their paperwork and stuff like that.
And I'm Dr. Abbasi. I'm a neurosurgeon. We are here in Minneapolis, and welcome to our podcast in the series of Essence of Medicine, All You Wanted to Know. Hopefully we will repeat that a lot. Let's dive into that without any further ado.
Okay.
So what did you always wanted to know about medicine, Kendra?
So I have quite the list here. Starting with a little bit of background. So where did you go for your undergraduate degree and what was your major?
Well, my path was very different than most of other people.
Yeah, tell us about it.
Well, because, I'm Persian, I'm from Iran.
Okay.
And in Iran, actually, it's a big deal to get to the med school.
Okay.
Because there is a method that everybody goes to examination, and then if you're really good, you get selected. I got selected to go to med school, and in Iran, you don't go to undergrad.
Okay.
In most of the world, actually, you don't go to undergrad, then grad school or med school.
Okay.
You go directly to med school.
Huh.
But it was pretty short after the revolution, and it was politically very unstable. And after a while, they told me I'm not religious enough to go to be a doctor.
Oh, wow.
I don't know what the connection is. Either way, I couldn't continue that, so I went to Germany. In Germany, I went for 1 year to what they call college to just learn the basic things. But then after that, I went to med school. That was 1989, a long time ago.
Oh, wow.
You probably weren't born there.
No, sir.
Yeah. And then I started my med school in 1989 in Germany. And if that was not enough, I started a PhD in computer science in 1993.
Okay.
I finished my med school in 1996 and my PhD in 1998. And then I was doing at that time still some residency. So in Germany or in Iran or in most of the countries of the world, you don't go to college, undergrad, and then to med school. You go directly from the high school to med school, and everything you learn in the college is integrated. There are some programs in the United States as well that you go directly, that are combined.
Okay.
But obviously, if you want to do medicine, most of the time you have to accumulate certain credits that are like biology and some physiology and other things that are suitable for what you want to do in the medicine. It's a long answer to your question, but I'm not a typical. So
that's very interesting.
This might not be the same for our viewers.
Yes, these are very westernized questions.
Yes.
So
and if you repeat your question, I try to answer it the best of
yeah,
my
no,
knowledge of the
definitely.
Americans. Go ahead.
I had another question. So in America, at least, you can do a combined MD PhD. Is that similar to what you did then for the computer science?
Well, in the US, you can do a combined MD PhD after you go to undergrad.
Yeah.
And in Germany, you can choose along the way if you want to do a PhD or not.
Okay.
As a matter of fact, probably lots of people do that. Probably more than half of the people do MD PhD. They decide to spend more time to do a PhD, but half of them, they don't. What's interesting, though, in Germany, you can be a physician, but to call yourself a doctor, you have to officially officially do a PhD. Meaning
Wow.
that in Germany, like I have some friends that went to same med school, and they're physician, but and the patient call them doctor, but officially they cannot call themselves doctor. They have to call themselves physician. Like in my German passport, there is a Dr. Hamid Abbasi. So that become official title that you carry with yourself on your passport.
Huh.
And you have to have I had to give them a certificate of my dissertation to put that doctor on my German passport. It's
That's
very,
interesting.
very official. Very official. Yeah.
Wow, that is really interesting. Okay, interesting.
But it took me 5 years to do that PhD.
Yeah, okay. In addition or at the same, it was at the same
Part
time,
of that
correct?
was addition, but part of that was after my med school.
Okay.
So, and my MD was, or my medical school was 1989 to 1996.
Okay.
And my PhD was 1993 to 1998.
Okay, so like a little overlap there.
Yeah.
Can you
Okay.
guys pause for a sec? I want to make a post on your LinkedIn just saying that you're live right now because you don't have any viewers. So
That's
it's
fine,
fine
still
if you
recording,
pause.
right? Yeah, yeah.
It's recording.
It says it's live.
Or your phone's recording now, right?
Oh, you do have a viewer now.
No, Xavier! So we're talking about how difficult it is, to in Germany to be called a doctor. That you have to have actually a PhD, a dissertation to be called doctor. But then it becomes really official.
Yeah.
It's not a trivial thing.
And then it's more than just your job.
So something you know about the German, you cannot call a doctor by his name. They get offended, I mean, in US we don't really care. Everybody call me Hamid or Dr. Abbasi and so on. But in Germany, if you call Dr. Smith or Dr. Schmidt, Mr. Schmidt, that's a very rude, that's a very offensive thing to say.
What if you call them twerp?
Dr. Twerp. Yeah. Okay, go ahead.
Interesting. Well, so since your situation was a little different, you didn't have to go to undergrad, decide a major, stuff like that. What made you want to go to medical school? Was it mostly that cultural impact, or?
Yeah, I think in most of cultures, and you notice it here as well, like alone dating a doctor is a big deal, right?
Yes. Yeah.
So it's not like they're like candy. Everybody's looking for one. Okay, they're like this unicorn. They have a good kind of social standing in most of the countries. Whatever you think the doctors have a good social standing here in the United States, make it 10 times more. That is their social standing in Iran. So actually, I was much better in mathematics and physics. I was my high school mathematic genius. Like I could solve the problem in a different way, faster, better than was in the textbook and so on. And I told my mom I wanted to go and study theoretical physics. And my mother said, yeah, that's great, but doctors are appreciated more in our society. So that was for me the deal. So in a way, even after so many years, it was my mother pushing me to become a doctor. And I'm not regretting it though, because I could combine my physics, my mathematical knowledge with my medical knowledge and achieve things that would neither a mathematician nor a physician could achieve just by that. That's why I can fix your computer so fast.
Yeah, I was going to say that's where that computer science comes in, is the physics you enjoy, and all your programs for research and analysis.
That is, I understand. I think I understand lots of things in physics and mathematics are basic how our body works. The whole world, in a way, is described mathematically. Our body is no different.
I bet you have like a very unique perspective in that way. And with like the OLIF, a lot of the procedure for the OLIF is mathematical.
It is.
Lining up your angles and measurements, stuff like that.
Wow, I'm so surprised, Kendra.
I did my research. I work here. I know what I'm talking about. Yeah, that's really interesting. I wonder, do you have any advice for a prospective med student or PA student?
No, I was just listening to a TikTok. Somebody was talking about intelligence versus compassion. Intelligence is a commodity. You can just look up things on YouTube, internet, Google, and acquire the information. Something that's harder to get and is truly not a commodity, but a core base is compassion. Look inside. If you're looking into going to medicine, look inside. If you can be compassionate about people,
Mhm.
If you can be compassionate about people and really care, you can go through every kind of pain, it's a painful process, but that keep you going.
Mhm.
If you're going there to just make a good buck or for a good pat on the back, you're going to burn out.
Okay.
So look into, can you work 24 hours and still when you see the next patient care
Mhm.
about their problem? Can you forget about all your problems? People come here to get their problem solved.
Mhm.
If you're compassionate about to care about the people more than any knowledge or thing and so on, do you really care about the helping other people? Then medicine is for you.
That is really good advice. Definitely with the burnout, because
Yeah.
I hear that a lot from med students, and you have to really have that empathy driving you at the core.
If you don't, you will burn out. That's not a
Yeah.
question. That's why burnout is so high, because we become compassionate about this and so on. But then sometimes we ask ourselves, when's my turn?
Mm-hmm.
Never. If you do what we do, caring for people, it's never your turn. It's ever, forever, it's going to be patient's turn. You had a bad day, doesn't matter. Your wife divorced you, doesn't matter. Your kid falls and breaks their leg, doesn't matter.
If you get a call, do you want me to let you know?
Yeah.
You just got a call.
About what?
From someone named Bondi or?
No, don't worry about
Okay.
that. I'm not worried about those calls. If it's a hospital.
How would I know if it's the hospital? Would it say
says
hospital?
hospital.
Okay.
It says hospital.
Thank you.
Then we stop and take care of it.
Being a surgeon never stops.
Nope.
You never get that break, like you're saying.
I don't need a break.
Mm-hmm.
I don't need a break. Lots of us, it's the reality.
Mm-hmm.
It used to be a calling. Being a doctor used to be a calling. It's now a profession.
Mm-hmm.
And even worse, it's going to be soon just a regular job.
Mm-hmm.
It went from calling to a profession to a job.
Mm-hmm.
And I think that is where lots of people have burnout and other things that you cannot have, at least not neurosurgery, maybe pathology or radiology or some other medical job can be a job, but at certain level, you cannot have it as a job or even profession. But let's go to the rest of your questions.
I have a question. Do you think that doctors are starting to have or people in general are starting to be less passionate? Or what makes you say it's becoming a job?
Now, every time I hear in medicine at my level, life work balance,
Mm-hmm.
that means your life and your work are not the same. And this is not a job, this is not a work, this is not a life that you can really separate. Like I do most of my research. You got an email late last night from me. Okay, so because that was the time I had time to get to that kind of things. Okay, this requires people say I give my 100% and so on. No, when you put that to true test, there are few people can really go through with that. But not everybody needs to do what I'm doing, and that's what it is. And that's why, in a way, that is why people truly put us on pedestal, because we are able to put our personal life away and just truly care for others. Now, some people want the attention, but they don't want to give what it takes to be on that pedestal. To be on that pedestal, meaning that truly you put all your life to the corner and concentrate on how you can help the next person. Now, people want the attention, but don't want to give that. That is the dichotomy that breaks them down. They have all the money, but they don't have any time to spend it. And you can buy that Austin Martin, but you have no time to show off with it. If that is what you go into neurosurgery, you can buy that Austin Martin, you can buy that Ferrari, and so on. You can do all of those things, but you literally the system grinds you, because the stress of that, those Austin Martin, those material things can carry it only for a while, and then they lose their. I bet when you bought that watch, you were very excited, And then after a while, you don't even know you have it. There's no different in any other material thing, like the big $80,000 watch and so on.
Mm-hmm.
They lose their allure.
Mm-hmm.
What keeps you going is that you truly make it different every day in one another. It is like every time you heal somebody and they like, I had a patient I just sent home and was laughing at me. I took a testimonial that I don't believe I'm feeling so well. Now, this is like a $80,000 watch for me.
Yeah.
But next day, I'm going to get another one of these. Next week, I'm going to hear it from another person. This reward,
Mm-hmm.
internal reward, just keep going. Whereas, how many Aston Martin are going to fit in your garage? You know?
Mm-hmm. Yeah.
Wrong motivation bring people to that burnout syndrome. Now, again, it's nothing wrong with people taking it as a job, but at a certain level, it cannot be a job.
There is, at a certain level and in certain specialties, there is no work-life balance. Your
No,
work
there
is
isn't.
your life.
Your work, and that is somebody 30 years ago told me. He told me that, looked me into the eye and said, Hamid, if you take it as a job, you will suffer.
Okay.
If you take it as a calling, if you take it as a life, being a neurosurgeon, you will have a blast. Have a blast.
That's awesome. That makes me really excited.
Yeah.
Like thinking about like being a neurology PA or a surgeon's PA, stuff
Yes,
like
and
that.
in a way, it's a good thing to be a PA because you get the good part of both worlds.
Yes, yes.
Nobody expects you, and to be dedicated in your 24/7 of your life
Mm-hmm.
for this,
Mm-hmm.
because then you would choose to go and be the high-end neurologist and
Yeah.
change the world
Yeah.
and so on.
You
So-
can have that work-life balance,
You
but
can.
still be compassionate and
Yes,
enjoy it. And,
Yes, this is the graduation of this. It
Yeah.
doesn't need to be one place or another.
Yeah.
So I really applaud people who sit down and say, I want to do this versus that, but you have to be aware of that each has its. I think the problem comes about that you want the benefit of one job
Mm-hmm.
and the life-work balance of the other job.
Mm-hmm.
That you cannot be a neurosurgeon in a trauma center and
But only want to work 40 hours a week.
you don't want to get the calls at 2 a.m.
Yeah, I know what you mean. That's really good advice.
Yeah.
Transitioning into advice for everyone, I'm curious from your perspective, what are your recommendations to a young person to keep a healthy back?
Well, this is a big change now. We are changing now. I made the video and it's called Natural History of Spine.
Okay.
It's about 15 minutes explaining how our back, how our musculoskeletal system work,
Mm-hmm.
and how to keep it best. Obviously, spine, and I could talk the whole day about this,
Mhm.
but obviously when we are born, our spine has no function. We are just on our back, we are just making funny noises. One day, when we are 100 years old, we are dead. All of us will be. And at that point as well, our spine has no function, right?
Mhm.
So we go from 0 to 0. And this is a question I ask many people, and all people are surprised actually. Between age of 0 and age of 100, where we go from 0 to 0, where do you think our maximum spine capacity, maximum spine efficiency is? Like elasticity, best muscle, best motion, best.
Teens.
Actually, you're right. Very good.
I didn't even rehearse that, I promise. I'm just thinking about when I felt my best.
Yeah.
Was in my teens.
Teens. And the proof of that is what age are the Olympic gymnasts?
Oh, yeah. Yep.
12 to 16.
Yep.
When you're 20, you're already too old for Olympic gymnastics. You
Feel
see
it.
lots of athletes. You see lots of athletes in their 20s, early 20s, because you need training and coordination.
Mm-hmm.
But that's not where your capacity of your spine is. After that, it goes down. If you build more capacity at first, you go down slower.
Gradually.
You have more
Yeah.
capacity to spend.
Okay.
If you're a potato couch, you have less to start with.
A couch potato.
Yes, couch potato.
You have less capacity to spend. You're building credit when you're a child, when you're a teenager. So have healthy habits, have exercise regularly, then you have more to spend. And as well, part of that is actually our genetic. Unfortunately, we cannot do anything for that.
That was one of my questions.
Yeah. Now our spine is made of bone and disc, and the disc, I tell my patients, is like a tire of a car. A tire of a car has lots of similarity with our spine discs, spinal function, because our discs separate the bone, or the tires separate the car against the road. You can have good tire like a Michelin or Goodyear, or you can have a no-name tire. That's your genetic. You cannot change. No matter how good your tire is, with aging process, it always will get bad. But the one thing we have truly kind of influenced, we as human, even with bad genetic, we can make strong muscle around our spine with regular exercises, healthy life habit, healthy posture, and that will protect our spine. As well, how we use our spine. Now, something many of our viewers may not like, but I'm going to say that people who do excessive sport, they don't have better spine. We know it from athletics. People who do professional athletic, by the time they are 30 and 40, their spine is like 50 and 60.
Okay.
This constant damage is not the healthy lifestyle I'm talking about, but healthy lifestyle is going for frequent walks, just mobilizing it, moderate sport, not
Okay.
excessive sport.
Okay.
Because we know excessive sport actually, especially those
Contact sports?
contact sport, like lots of hitting,
Okay.
it just wear and tears. If you have a nice tire and you go off-roading every weekend,
Yeah,
that tire is not going to last you too long.
that's true. So what exercises would you recommend, or what sports would you recommend?
There is a good blog, actually, it's called Bob and Brad. If you're interested, they talk a lot about
Okay.
what healthy lifestyle is. But it is a good idea to put your body at 90th percentile of what your body can do regularly, but not all the time. Like most of the activities you do should be at 50% of your body's capacity. I would say probably 80% should be at 50% of your body's capacity, and that's different for everybody. Then you should do 10% activity that is put you at about up to 90% of your activity, and another 10% that put you close, but only less than 5% that put you at your close to your 100% of your body can do.
Failure, kind of.
Yeah, very little, but that's important. That is that is where your body builds muscle.
Okay, so
Literally.
like strength training type stuff.
Now, like let's say something like curling. Okay.
Yep.
Let's say you can curl like 50 pounds.
Not me, but we can pretend.
Yeah, pretend you can do 50 pounds. You need to do only 2 or 3 curls every other day or twice a week for your muscle to work for that level. Anything beyond that, you are actually overusing your joint and so on and so forth. So do very little at the edge of what your body can do. Do most of that at the mid-level of what your body can do, and that keeps you healthy, strong, and still keep you at the edge.
Okay. So you mentioned briefly poor posture. Do you think that poor posture can lead to back or neck pain?
Obviously. I think we know from our own life that in certain situations, certain position, our back is just bothers. I'm not in your age, obviously, but in my age. Yeah, so back certain position put more stress on that. Now, this is something people can maybe understand better if we use that Mr. Skeleton in back there. Look at the torso of that skeleton. Look at from here to here. This is about this big, and the depth of the vertebral body is about 2 inches max. So we have 2 feet versus 2 inches.
Mm-hmm.
This is like a crowbar.
Okay.
So meaning that if you have a bad posture, actually what happens is that your body works like a crowbar, and that force magnifies like a crowbar, that you can break things by magnifying the force.
Mm-hmm.
So if a regular person bends, a 70 kilogram or 150-pound person can produce a force of a small car on the spine,
Wow.
1 metric ton of pressure.
Wow.
So especially twisting.
Okay.
If you have a wet towel and you want to get the water out of it, what do?
You wring it. Yeah.
You wring it, you twist it, because we know the screwing of the twisting action provide tremendous amount of pressure that push the water out. Our discs are no different, especially
Okay.
bending, twisting, combined with lifting.
BLT.
BLT.
Yep.
It's not a good thing for our spine.
Okay.
And that's why we tell our patient not to do that. Guess, since we are in Minnesota, what has all 3 of that?
Shoveling.
Shoveling.
And I have heard that from patients. That's why I know that.
Shoveling is, the God did not bless us with the best weather here.
Mm-hmm.
So the shoveling combine all the wrong things that make your spine fail.
Do you think, besides maybe wearing a back brace, the only other thing you can try and help is to really engage that core while you're shoveling?
Absolutely. The shoveling, it can be an exercise.
Mm-hmm.
If
Yeah.
you do the right way.
Yeah.
But you remember we said, you do 50% of your regular midway of your capacity, only 10%.
Mm-hmm.
Unfortunately, it doesn't snow often enough that we do 50%. Snow shoveling is always you do that maximum things,
Yeah.
and you want to get it done,
Yeah, so you're trying to take those big scoops
yeah, you want
too.
to get those exactly, big scoops, and that is can be tremendous amount of pressure on your spine. But I think your question was, does the core body muscle help? Absolutely.
Okay.
Many times I get this athletic patient,
Mm-hmm.
the arms and legs are tremendous, but when I do their surgery, they have not enough muscle around their spine to help them with those big arms and legs. So
Mm-hmm.
this balance, the arm and legs can do things that their part between is not ready for. That's when they end up with me.
Okay, so don't skip core day and don't skip back day.
One of the things with the exercises and so on, especially men, but women no different. We exercise those muscles that we can watch them in the mirror.
Mm-hmm.
If you
Yep.
don't see them in the
The
mirror,
aesthetic exercises.
if you don't see them in the mirror, you won't train them, and that come back and haunt you.
Okay.
Okay.
That's really good advice. I'm gonna take that one to heart because I do skip core. Okay. So do you speculate that there will be more neck problems in the future with the way that society has become so technologically driven?
No, I
You don't
believe
think so?
I'm a very optimistic person.
Okay.
Look at that. No, people who listen to that, they know more. And
You
they
haven't
know
heard of tech neck?
Yeah.
this technique.
It's
You mean the
it's
looking
this
at the thing?
phenomena of in younger people hunching over like this.
Mhm.
They call this posture technique or forward head posture.
Yeah,
Do you think that'll have any consequences?
and within a year or two, they will put it in our glasses or in our lenses or directly in our brain. I'm an optimistic person.
True.
I think we will have, and the history of human, another hobby of mine is history. We have never lived in a better time in the history of human life. Less people die of disease, war, famine, and the problem we are having now, it's never have been a better time to control the medical problem we had. Because look at people who are listening to this, they know they should go and exercise their core body muscle. It is just by listening to this, there's less likely they will have that problem. So I'm a very optimistic problem that our problems in the spine and our spine problem and our aging problem are going to be more manageable. Now, having said that, something is positive by itself but works against us. Most of spine problems is aging problem.
Mm-hmm.
The good news, we live longer. Bad news, we will have the consequence of having aging spine.
Mm-hmm.
But we are in the process of fixing that.
And we'll have better surgeries when you keep
We already
devising
do.
these better surgeries.
We already do. Like,
Yes.
today, I did a surgery on somebody who has a high BMI,
Mm-hmm.
who two surgeons said he cannot have that surgery, it's too big.
Mm-hmm.
I did that surgery in a surgery center. That patient woke up, sent me a testimonial, showing me a big thumb, and they're already home.
Instead of
They
in
already-
a hospital
Instead
with
of, no,
with day
no.
stay.
Two surgeons told him he cannot have that surgery in a hospital.
Yeah.
We did it in a surgery center in 58 minutes
Wow.
and sent the patient home 2 hours later. We're already in the future.
That is crazy.
We don't
That's
recognize that because we do it every day,
yeah.
and we get a lot of hit because people think it's not possible. What we are doing is not possible. We do it anyways.
Mhm.
It is like that phrase that they say. Lots of aerodynamic scientists came together and decided or they recognized Bumblebee is so aerodynamically bad, shouldn't be able to fly. Bumblebee doesn't know and fly nevertheless. So that
I
is
like
the story
that.
of us.
That's
We do it. What people say is not possible. We do it.
that is really I'm gonna keep that one. That's
Yeah.
a good one. Let's see here. I'm curious. This is a pretty basic question, but I'm curious. What causes the popping sound when you crack your back when you're at a chiropractor?
That is a fantastic question. What do you think?
Well, when they say when you crack your knuckles, it's the air in the joint or something
Perfect.
escaping.
Wow, I'm impressed.
Is it the same for the back?
So in the back, our back is connected with the disc,
Mm-hmm.
and in the back we have two joints. They are called facet joint.
Mm-hmm.
The facet joint behaves like any other joint. It has a capsule, it has a fluid inside, and if you separate it too fast, you literally by creating vacuum, you're creating the bubbles of the water inside.
Okay.
Have you ever looked at like a boat? In the back of the boat where the propeller is,
Mm-hmm.
you see air, like bubbles.
Mm-hmm.
Do you know what those bubbles are? By creating a vacuum, you're reducing the boiling point of water.
Oh.
A huge vacuum, actually, you can boil water in air temperature by creating a vacuum, and those propellers doing that by rapidly opening up the joint, you're reducing the pressure, and literally you create this bubble that almost they expand and they explode. They explode and then they collapse, and that is what you hear.
So it's the air around the facet joints, not
They're in the facet joint.
in the fluid of the
The
facet
fluid,
joints,
the
not
synovial
like
cyst and the synovial
okay,
fluid.
not like the fluid or the stuff in the disc or between the disc. It's
No,
Further
it is a
back.
facet.
okay, very interesting.
There
Yeah,
is
I
no
would guess.
space. The disc is such a confined place, it doesn't produce anything. There's no space there.
Okay,
But
got
the
it.
facet joint, like any other joint,
Yep.
they have this space that you can rapidly expand
Huh.
and create that like exploding little mini bubble. They
Okay,
explode and then collapse, and they
Okay.
give you that noise.
that's interesting. Okay. Speaking of chiropractors, I'm very curious from your perspective.
Mhm.
What is your opinion on chiropractic work? Do you think it can provide lasting relief for an individual? Do you
Mhm.
think placebo plays a role? What are your thoughts?
Well, this is the contented kind of area. The fact is, 1/3 of the people when they have back problem, they go to chiropractor and they do a tremendous good job helping the lots of patients. Now, like any other job, like there are lots of doctors and surgeons helping people, few are hurting patients.
Mhm.
Now, sometimes chiropractors are no different. Tremendously, they help the people, and sometimes the things are out of their hand, and sometimes even what they do harms the patient. No different. Sometimes we doctor help hurt the patient. Now, it is in my kind of business, neurosurgeon, we have this standish off kind of attitude to our chiropractor, because we always only see those people who they hurt and they end up with us. Whereas like imagine imagine I'm like a spine surgeon. Once a while, my patient have heart attack while I'm doing the surgery, and then I send them to cardiologists. The
And they
cardiologists
hate
they
you.
only see those spine surgeons who have heart attack. They say spine surgeons are people giving this patient heart attack.
Yeah.
This is no different. I think we
Okay.
have to be just realistic. But this is a bias, that selection bias
Mm-hmm.
that people
Yeah.
know in lots of other areas
Mhm.
and so on. But we have a multidisciplinary. You work a lot with chiropractor, and a good chiropractor knows what they are good at and what they are not good at, and they stop and send the patient to us. No different than a good spine surgeon knows when to do surgery on patient with a cardiac problem and not and send them to cardiologist. No different.
Okay. Very interesting. So you don't end up seeing the patients that chiropractic help them, so
Because they
therefore
have no reason for them
Yeah.
to come to us, right?
that's a good point. That's a good
Yeah,
point.
and that is what exactly the selection bias is.
Okay. Makes sense. I'm curious, do you suggest that patients who are in PT or physical therapy try other methods such as dry needling or acupuncture?
I'm a Western trained surgeon,
Mm-hmm.
okay, and we don't train on acupuncture.
Mm-hmm.
There's some good base on that it can help people, but a good acupuncture, to my best knowledge, doesn't hurt the patient.
Okay.
So meaning that just because I don't know about that doesn't mean that the effect of that doesn't exist. We don't have enough evidence on the Western part of the world to understand how it works and so on. But it doesn't mean it doesn't work. So meaning that I tell my patient, try it out. If it helps you, anything that helps the patient is good.
Okay.
But it is not part of my training, so I stay away from that. Like,
Okay.
it's not part of my training to fly a helicopter.
Mm-hmm.
I'm using helicopter, not an airplane, so I stay away from that.
Okay, that's fair. It doesn't mean you won't tell somebody who knows how to fly it to fly the
No,
helicopter.
go in an airplane or a helicopter, fly with it if you know that pilot is doing that well and so on. But
Okay.
so I'm going to stay with things that I have a knowledge of,
Okay.
rather than just comment on random things.
That's fair. So because you are able to do the OLIF procedure, which is minimally invasive compared to open traditional surgeries, I'm curious, how old is the oldest patient you've ever operated on, and how young is the youngest?
So let's talk about me as a neurosurgeon, because
Yes.
as a neurosurgeon I do more than just spinal fusion and so on.
Yeah, I'd like to hear more about the other surgeries
So,
you can do too.
The youngest patient I have done surgery was a preemie, 24 weeks old. The
Wow.
baby wasn't feeling my whole hand.
Wow.
Yeah, you could see through the baby. And they have sometimes problem with the brain and circulation of the fluid in the brain. So we had to put a tube in the brain. And so that was like minus 3 months.
Yeah, wow, I didn't even know that.
Yeah, the oldest patient I have done surgery was a 95-year-old patient
Wow.
that could barely walk, was otherwise healthy, and so anywhere between.
That is crazy. So tell me a little bit about your neurosurgery background besides just fusions.
Yeah, besides spine.
Yes.
So, a neurosurgeon deals with all the diseases of the nerves,
Mm-hmm.
anywhere in our body,
Mm-hmm.
and that is mostly brain, spine, and peripheral nerve.
Mm-hmm.
And in a neurosurgery residency, we get a good exposure to all of that. And I didn't have a 7 years residency like most of people. I got it twice of that. So I was pretty good at all of that. But once I came to Minnesota, I had to choose something that I can excel at. That is my nature. What I do, I have to excel at. And
Mm-hmm.
it is hard to excel at 50 different things.
Yep.
So I chose minimal invasive, and truly excelling is what we do here in Inspired Spine
Mm-hmm.
for spine.
Very interesting.
My fingers are going numb.
Okay.
Let's see. I'm curious. Why?
How much time do we have?
Yeah,
Well, you've been going for over 30 minutes.
30
we
minutes.
could
That
save
would be-
some for another time.
Yeah,
What
we
I'm
should
doing
say-
on your phone is every question I'm starting and stopping. So if you want to use them on TikTok,
Yeah,
Okay.
yeah.
That's smart. If you'd like to, I have obviously a lot more.
So-
We could go.
What do you think? Should we go a little more?
I mean, I think you can, but I think it'd be nice if maybe like every other Friday we ask
keep
these
going.
questions again.
So that is what we should do. Every other Friday we do a podcast like this.
Yeah.
And every other Friday we do our film review. We put films on, like radiologic pictures. That's mostly interesting for all medical professions.
That
We did it last week,
that
actually.
was like one of my basics of reading a lumbar MRI. That was one of my ideas.
Great.
There you go.
And join us next week. We are
Okay.
going to do every other week. 1 week we are going to do a podcast like this. We sit down and answer questions, even maybe from the viewers. And every other week we just put up films. Please connect to Nick, and Nick should choose 20 pictures.
And I told Nick to blur out all the photos ahead of time so people don't need
Yeah,
to sign anything.
yeah.
Maybe I think like
Are we done here?
well
Well, I don't.
you have two people on.
Oh, nice, nice. Two people. Hello.
The vibe changes.
We start trying.
I think every other week, so the CT weeks, you should ask the students questions that they want answered the next week for our podcast.
Sounds good. I think that's what we should do. You want to take ownership of that? That you ask the students, you gather the question, you be the moderator, and you make
I
sure
manage the time
and so on.
because some of these questions went like pretty long, so you
Yeah.
won't be able to use them on TikTok, but we can put a timer.
Well, thank you for whoever is for the two people who joined us. I hope this will record, but otherwise we say just goodbye and everybody have a good weekend.
Long weekend.
Okay, thank you. So how do we know if it's